Dacryocystitis. Introduction. Dacryocystitis is an infection or inflammation of the lacrimal sac due to obstruction of the nasolacrimal duct. This condition leads to pain, redness, and swelling near the inner corner of the eye. If untreated, it may cause complications such as abscess formation, chronic infection, or orbital cellulitis. Definition. According to the American Academy of Ophthalmology, dacryocystitis is defined as an infection of the lacrimal sac, typically due to nasolacrimal duct obstruction, leading to inflammation and accumulation of purulent material. The World Health Organization, WHO, describes it as a condition characterized by blockage and infection of the lacrimal drainage system, resulting in tear retention and secondary bacterial infection. Types of dacryocystitis. Acute dacryocystitis, sudden onset with severe pain, redness, swelling, and fever. Chronic dacryocystitis, long-standing infection causing persistent tearing, mild swelling, and recurrent discharge. Congenital dacryocystitis, occurs in infants due to an underdeveloped nasolacrimal duct. Secondary dacryocystitis, due to tumors, systemic diseases, or trauma. Risk factors. Age, more common in infants and older adults. Gender, slightly more prevalent in females due to narrower lacrimal ducts. Chronic sinusitis, increases the risk of obstruction and infection. Eye trauma or surgery, can disrupt lacrimal drainage. Poor hygiene, can lead to bacterial infections. Use of contact lenses, may introduce bacteria to the eye. Etiology. Congenital causes, failure of nasolacrimal duct canalization in newborns. Acquired causes. Infectious, bacterial infections, example Staphylococcus aureus, Streptococcus pneumoniae. Inflammatory, chronic sinusitis, conjunctivitis. Trauma, injury or nasal fractures affecting the lacrimal drainage system. Tumors, nasal or orbital masses obstructing the duct. Systemic conditions, sarcoidosis, Wegener's granulomatosis. Pathophysiology. Obstruction of the nasolacrimal duct. Down arrow. Accumulation of tears and mucus in the lacrimal sac. Down arrow. Bacterial growth and infection, common pathogens, Staphylococcus aureus, Streptococcus pneumoniae. Down arrow. Inflammatory response leading to swelling, pain, and redness. Down arrow. Pus formation and possible abscess development. Down arrow. Risk of orbital cellulitis, vision impairment, or sepsis if untreated. Clinical manifestations. Swelling, redness, and tenderness over the lacrimal sac. Excessive tearing, epiphora. Pus or mucopurulent discharge upon pressing the lacrimal sac. Pain and warmth in the affected area. Fever and malaise, in severe infections. Blurry vision due to excessive tearing. Diagnostic evaluation. History and physical examination, identifying symptoms and tenderness near the lacrimal sac. Fluorescein dye disappearance test, assessing tear drainage efficiency. Lacrimal probing and irrigation, confirming nasolacrimal duct blockage. Microbiological culture, identifying causative bacteria for targeted antibiotic therapy. Imaging, CT/MRI if orbital cellulitis or tumors are suspected. Pharmacological management. Antibiotics. Acute cases, broad-spectrum oral antibiotics, example amoxicillin clavulanate, cephalexin. Chronic cases, long-term topical antibiotics, example moxifloxacin, ciprofloxacin. Pain management, nonsteroidal anti-inflammatory drugs, NSAIDs, for pain relief. Warm compresses, helps to reduce swelling and promote drainage. Surgical management. Dacryocystitis, DCR, creating a new drainage pathway for tears. Lacrimal probing and dilatation, widening the blocked duct in infants and mild cases. Lacrimal stent placement, inserting a tube to maintain patency of the drainage system. Abscess drainage, in severe cases, incision and drainage of pus may be needed. Nursing management. Nursing diagnosis. Interventions. Acute pain related to inflammation and infection. Administer prescribed analgesics, apply warm compresses, and educate the patient on pain relief techniques. Risk of infection spread related to bacterial accumulation. Maintain hand hygiene, administer prescribed antibiotics, and educate on proper eye care. Impaired vision related to excessive tearing and swelling. Monitor visual acuity, encourage the use of artificial tears, and refer for surgical intervention if needed. Prevention. Proper eye hygiene, regular cleaning of the eyes and avoiding contaminated hands. Early treatment of eye infections prevents progression to dacryocystitis. Avoiding eye trauma, reducing risks that can cause duct obstruction. Prompt management of sinusitis prevents secondary infections. Newborn lacrimal massage helps open blocked tear ducts in infants. Complications. Lacrimal sac abscess may require drainage. Orbital cellulitis, infection spreading to surrounding eye tissues. Vision impairment, due to chronic infection and scarring. Sepsis, rare but can occur if infection spreads systemically. Conclusion. Dacryocystitis is a common yet serious infection of the lacrimal sac, often caused by nasolacrimal duct obstruction. Early diagnosis and appropriate treatment, including antibiotics, warm compresses, and surgical correction, are essential for preventing complications. Proper eye hygiene and awareness of risk factors can help in the prevention and effective management of this condition.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.